Today we are presenting what we have called the 21st century facelift. This is because we have added to our regular procedures the fat grafting into the mid-face, the melolabial lines, and all those areas that lack of volume, which is produced due to the aging process. In the past, little attention was given to those changes that occurred on the face because of the lack of volume. Everything was just blamed on the skin excess and the sagging of the muscle. However, we learned over time that just pulling the skin and lifting the muscle was not given to the patients a younger appearance. In order to do that, surgeons started to give more volume, especially to the mid-face, in different ways. One of those procedures that was popular in the 90s and the beginning of the new 2000 decade was done by working with the endoscopes in the face on the deep planes. That was followed by very complicated and painful post-operative recovery. We realized that patients were not happy with those procedures because of the time they needed to recover. Later was suggested that we could achieve the lack of volume that now we get with the fat grafting with silicone implants. That approach was not also so pleasant for the patient because they really don't want to have anything strange in their face, and also they were afraid of that would change his or her natural appearance. In order to avoid these problems, we started to perform the replenishment of the fat into the patient's face. At the beginning, merely we were injecting the patient's fat. However, this procedure sometimes worked, sometimes didn't work. So in order to improve the result, we and other surgeons started to work with the stem cells. By isolating the stem cells for the patient's own fat, we are able to improve those fat grafts and be more sure that they are going to take and they are going to remain where we want them to stay and where we place them.
My name is Dr. Duncan Ross, and I'm a stem cell scientist here where I work with Dr. Carlos Spera to isolate stem cells from adipose tissue lipoaspirated from patients here at the clinic. Once we have the fat digested, we then purify it. We work within sterile conditions, and after enzymatic digestion of the fat, we then centrifuge it to isolate stem cells. The speed is increasing of the centrifuged fat. This will isolate the stem cells after we have processed them.
Once the fat has been manipulated and processed, we then obtain a sample that we then look at under the microscope to make sure of the viability of the cells and the cell count itself. And then we also download it into our computer to have a permanent catalog of the stem cells, which we then inject, or the doctor injects into the patient.
With the combination of the more traditional and standard procedures and the fat grafting as we described before, we are able now to rejuvenate the patient's face with a fast and quick recovery and achieving the best possible result.